Time now for this week's Health Matters. Paul Critz along with PA Lynn Szabo. And you said in the email I got about today's show, it says it's that time of year again. Is it really that time of year again?
Yeah.
Because it doesn't seem like that time of year, but yeah, I guess
it totally is, at least in the medical office. So it's a sports physical time of year again.
All
People
right.
getting their kids ready to go back to school, and this is one of the things that happens.
Mm-hmm.
And that's because 50 to 60% of kids participate in organized sports.
Wow.
I think it might be higher here, actually.
Really?
Well, it depends on the age group, really, but there's a lot of the community big into football, big into soccer, big into basketball, all for, I think, cultural reasons. And then super big into cheer, which is considered something that is a sports physical for it too.
So now you're not just talking about like school sports. You're talking about like league sports, like the okay, right, right. Yeah, that makes sense. There are thousands of kids involved in those things.
Right.
Yeah.
And these are the joy of family practice. This
yeah.
is like the funnest visit ever.
Okay. Oh, cool.
So
I'm so used to talking such dire things with
I
you.
know. I thought we needed a little joy.
Right
anyway, and because they're usually healthy kids and they're usually super motivated by what's going on.
Okay. They're into it, right?
The parents also, this is a little kind of time where parental pride is allowed to shine. And specifically with the dads, they come in oftentimes with the sons for physical, specifically for football.
Oh, wow.
And what I do when I talk to them is I try and get an idea of what sports they're doing and what positions they might play, as much as I understand football. And I try and, like, is that a defensive position? So you're going to be, trying to kill the other guy, right?
Right, yeah.
Or as opposed to a running position or catching. So,
Okay.
yeah. So then that helps me target what skills the kid's going to need and what I should look for medically also.
So over and beyond just like, baseline physical health, you're looking at how you can make sure they don't injure themselves like down the road with these.
Right.
Wow. Okay.
Yeah.
Okay.
So the sports physical, the point of it is mostly to maximize safety. Okay. And there's a number of ways to do that. One is the individual kids' safety. One is the league's safety in case, something unrecognized injured somebody on the playing field and there was a legal liability. They can say that, look, they had a physical and that wasn't apparent.
Yeah. CYA.
And I don't think the parents understand how much of a time to check in with the health of their kid is and how important they actually are. They see it mostly as a paperwork thing.
Oh, a thing you got to check off so you can go to the practice and the games, right?
Yeah. So ideally, this is to identify medical problems that could be life-threatening, and most of those are cardiac, maybe asthma. Most deaths on the field, if they happen in young athletes, not counting things like accidental stuff like lightning strikes or something, are either cardiac or a small amount are pulmonary.
Wow, okay.
Yeah. And then it's a good time to identify and rehabilitate old injuries, to talk about, oh, you broke your ankle 2 years ago. Okay, so what did the ortho guy say? Do you still have hardware in there? Did you go to physical therapy? Are you walking around school okay? Stuff like that. And to treat conditions that limit performance, and that is most likely asthma. Do you have your inhaler? Do you need your inhaler before the game? Does your mom, who is at every single one of your games, have it in her purse or pocket or something? So those are the main reasons to do it. Ideally, it should be done within 4 to 6 weeks of the actual sport participation, but this never happens.
What do you mean? Why not?
Right now we're doing them mostly on cheer and football, but also soccer. But these ones could count for basketball or golf in the spring or baseball, maybe. So, and the reason for that is that they're usually tied to a well-child check. So well-child check is a healthy kid physical exam. And it comes with a lot of requirements that are, like vision screening and hearing screening and immunization updates and stuff like that are, at least in partnership, kind of designed to make it a more valuable to the community kind of physical into the kid.
Okay.
Yeah.
Okay.
So, but they reimburse really well.
Who does?
The insurance companies when you do a well child check as opposed to a sports physical.
Oh,
So the Venn
okay.
diagram overlaps, but it's not 100% the same.
I'll be damned.
And you
Okay.
get most kids who, by the time they're in elementary school, they get one well child check a year. And
Okay.
so this is usually their shot. So
Wow. Okay. So
Yeah.
so what does the parent gain if they like? Okay. How does a parent work that? Do they call and say I want to make a well child check, and or what do they schedule? How do you play that?
I think you can automatically assume that if you're asking for a sports physical, I mean, these are so lucrative that the receptionists and the medical assistants have been trained to flip it in and the documentation and the chart to a well child check,
Okay,
and then do
okay.
everything that's associated and expected in a well child check.
Is that something a parent even needs to be cognizant of, or is this just something happens
it's on
the back
autopilot
end?
because
Gotcha.
because it's beneficial to the clinic,
Okay.
the office.
Okay.
So the components of the evaluation, whether it's a well child check or a sports physical, but especially sports physical, is the forms are the most important part.
The forms are
And
the
then
most important.
The odious parents hate doing them. I could tell when they haven't read them because there's trick questions. And if they just hit no and draw a line down.
Wait, there are trick questions?
There are trick questions embedded kind of toward the end
Okay.
of a million check boxes.
Wow,
And
just to see if you're consistent in your answers? Is that what it is? Like asking you the same
I think it's
question
just
again?
happy coincidence. I don't think it's really a trap. But my eye goes immediately when I see one of those, automatic. It looks automatic. The handwriting's all the same, and then I'll go to the one question that should be answered yes. That's probably in the last. There's like 40 questions.
Gotcha.
Probably in the at question number 35.
Yeah, okay. So
And
like
I'll
it's
say,
asking, have you ever had, and they just go, no.
no. And then your eyes glaze over, and then you just,
Right, right.
And then, did you really mean to answer this one? No. And the question is, are you happy with your weight?
So that's like the green M&M. Right?
Yes.
Yeah, right.
Absolutely.
Okay.
Absolutely.
Or
And
the brown
so-
M&M or whatever it was in
Yeah.
Van Halen. But yeah.
And these million questions are my best defense, I guess, at malpractice.
Okay.
So if I missed something in a kid, let's say a heart condition that wasn't expected, then these questions are designed to elucidate that. And if something gets by even that, I mean, that's hard to believe. I've never seen it happen.
Wow.
Then I could say, look.
Yeah, here's the
they
form.
did the
right?
paper. Is this what you meant to fill out? Did you read it carefully? And so they're really important for medical legal reasons, and the medical assistants and the parents don't really get that. They don't understand that. So there's a lot of hang up with, oh, they didn't bring the form, or they're going to fill the form out later, or, but it is the most critical part of a whole sports
No, I can see
physical.
that. It kind of sets up the
Yeah.
parameters and the context, and it's the
Right.
first step you take. Yeah.
And so we look for clues about history of family history, especially heart disease. So certain kinds of sudden cardiac death in young people are genetic sometimes. And so you can get a clue if somebody's had maybe an unfortunate event earlier or with somebody else in their family. We also look for history of concussion. And this is super important, especially in football. And I think the parents kind of sometimes say no, and the kid's going, looking at him like,
Wait a minute.
what?
Because concussions can get progressively worse, right? Can't they? Once you
If you get a lot of them. And there's also a good resource up here, and I'm sorry I don't have it more specifically, but what used to be known as HSU has a concussion study where they will evaluate your young athlete and keep records on them. So if the individual has more than one concussion, they can get actually better testing than they would get in like a peds office and have it on file. So,
and do you know, I mean, I'm asking questions. You say you don't know, you don't have more information in front of you about that, but is this open to the public or is it
yes,
something? Okay.
it is. And I usually get the specific name in the website. It's
Okay.
online. You can just Google concussion and whatever HSU wants to be called now. I'm still in denial. So it also includes a complete exam with emphasis on heart, neck, and musculoskeletal. And so my exam, and they're really fast. It's like eating candy. They go down really easy. The vast majority of these kids are healthy.
Sure.
And that's pretty apparent. Now, remember, the provider is watching the kid while they're in the room. So there's more to the exam than you would think. So ears, eyes, nose, and throat, head and neck. Okay. So that's important. Lungs and heart. And specifically for heart, you're looking for the kind of murmurs that might be indicators of the sudden cardiac death syndrome in young people. And there's different, if you hear something, there's different maneuvers you can do to kind of isolate that and understand it further. I almost never hear anything terrible. And then, the other thing, if you're listening to lungs, you're looking for like wheezing. So does this athlete have an asthma issue? And then abdominal exam, and then musculoskeletal. Now, for the boys, they're always worried, and I think they've been prepped beforehand, that somebody's going to make them drop their pants and check for hernias. They don't. I don't know of providers that really do that anymore. I'm not certain what that would add to the.
I was that generation. I had to do that in school.
Oh my God!
I'm like, what's this for?
Yeah,
Is somebody going to run up to me and do this on the field?
I know. You would think you would know something was going on, but back in the old days, like 30 years ago, I with a group of doctors at in Humboldt, we did like 500 sports physicals in one evening, and we all broke it up to like I did ears, eyes, nose, and throat and neck. But there was Dr. Russell Pardo, who was a plastic surgeon who sadly has passed, such an asset to the community there. He did like 500, well, it's probably like 350, turn your head and cough.
Oh, no.
Turn your head and cough. And so he was kind of had this little private area, but it was next to where I was, and for the whole night, turn your head and cough, turn your head and cough. And he didn't find anything that was of significance.
Wow.
So I don't do it.
Why
So
is that
rest assured, young men, I'm not going to make you drop your pants.
Is that a holdover from previous understandings of health and such?
Yeah, I guess so.
Wow.
Previous hernia obsession, I don't know. Hernias are surgically repaired, so maybe it was a screening for possible surgical intervention. I don't know.
Wow. All right.
But I have never in my whole history, there's never been anything that's found, much to the chagrin of the young male athlete, because they act like they're dying. And it must be pretty embarrassing. So that's my exam. I like to, in the musculoskeletal thing, I actually make them do maneuvers standing there. So
like what sorts of things?
Yeah, arms above the head, make sure their elbows bend, make sure they can flap their wrists around.
Make sure their elbows bend.
I have them touch their toes, and it's kind of interesting. They get a little obsessed with actually touching their toes, but that's not. I'm actually looking at the straightness of their spine.
Oh wow, you're not even looking at how close they come to that.
They're all like, I can't touch my toes, and I'm like, doesn't matter, just try.
Doesn't matter. You've got scoliosis. Oh no.
And then of course they have to do a squat, and then they have to do a squat staying in the squatting position and take a couple steps, and that's kind of known as the duck walk. And it's kind of funny how many, like I've done these on college athletes, like college football players, and watch them fall over because they don't know how to do a squat.
Well, Chuck Berry hasn't been with us for a while now, so maybe we're starting to lose that knowledge culturally.
Yeah, and so they're looking at me like, what's a squat? A 7-year-old doesn't really know what a squat is.
Right.
So I kind of call them sit stands.
Oh, okay.
And then they make me do it, which I'm an old lady, and that's just mean. And that whole thing does not take very long, really. The longest part is reviewing the history, looking for concussion.
Have you ever found anything? Ever?
Yeah, I've flunked people.
Okay.
Yeah, and we're going to talk about that.
Oh, okay. I didn't read ahead.
Actually, is that a segue to the?
We're skipping over the COVID one.
Yeah, right now.
Okay.
So, what I've found is mothers who oftentimes don't have insurance or don't have time, they don't have the help they need to get their kids to the doctor. And they'll start talking about stuff that happened months ago that wasn't evaluated and should have been at the time. And oftentimes it's stuff like passing out without a good reason. That's an automatic fail.
That's a red flag across the board.
And that's why didn't you take them to the ER? You took them to the ER for flea bites. Why didn't you take them for fainting or falling out or whatever it was that happened? Because that affects so many things.
Yeah.
Including, and people don't get it until I say, well, it could affect your ability to get a driver's license, and all of a sudden it's important.
Oh, wow.
But
just random LOCs like that. Sure.
Right. So, you're so in the know.
I watch. Well, it's from watching. It's from 20 years ago watching ER.
Yeah. So, parents who are taking a kid in for sports physical should not try and cram a year's worth of healthcare issues that should have been addressed at the time they were happening. Because especially if you're telling me, well, his knee really hurts and it's giving out on him, and sometimes it's so that kid is flunked until he goes to the orthopedist. And in here, that could take months.
If you're right. If you're using the okay, so it seems like on one hand, like the provider is using these sports physicals as a well child checkup.
Yeah, and that's financial.
Sure. Why can't the parent do that too? By coming in and saying, okay, look, this kid has lots of other things as well. Because
what
it undercuts.
I would do, because usually they're like months ago, and so they're not in context. So if a kid has something alarming enough that you're going to bring it up during this physical, then you have to be prepared for two things. One is the provider asking you why you didn't get it addressed at the time it was happening, and also that they're not going to pass the sports physical. And so the people that I have not passed, that's mostly been the thing. It was a sick kid with a delay in access to care for some reason. And but on the other hand, see, I was thinking about this before I came here this morning. This is a fine line, what you tell the provider about your kid, if your kid has a health concern. And the people who have also, where I passed a kid once who didn't bother, his parents didn't tell me anything about his hemophilia.
Oh, no.
And so this was at Arcata High School. It was kind of a cattle call, a million kids getting sports physicals. Nothing on the piece of paper about his hemophilia. And so I passed him, and then I got a random phone call like 2 days later from a physician in the community saying, these parents intentionally hid this from you.
Oh, wow.
Now, if it was me, I wouldn't have passed him, and I would have bounced him back to his pediatrician. So I rescinded my pass and sent him to his usual physician, who was happy to pass him because he had more knowledge about it.
Sure.
And he was, at that point, they wanted the kid to be a kid and not so much worried about, bleeding, I guess.
So if your child has a situation like that going on, is it best just to forego the sports physical and just keep it with your...
Right. So if your kid has like a history of open heart surgery, then it would be better to get the sports physical cleared by their pediatric cardiologist.
Who has the history. And
right. And so remember, there's legal liability associated with this. People don't think of that. And oftentimes UCSF, the pediatric cardiologist will go, well, there's no reason they can't play. Well, I'm an urgent care PA. I don't really know that.
Right.
I don't have those records.
Fine. Put that in writing, Doc.
Yeah, so put it in writing. So I oftentimes will, in parent sector, like the first time it happens, they understand the procedure and they'll just bounce back the next year to the specialist, which is appropriate. So don't lie about what your kid has, but don't use it as an I guess, an opportunity to go through every scary thing that's happened to the kid for a year and expect there not to be a response.
Right. Exactly.
Okay?
Exactly.
So, and then the next one is COVID, because, and I think we might have talked about this before actually on the air, but there was a period of time in the, just after the Delta wave where the pediatricians, especially pediatric cardiologists, were telling us that any kid that had COVID had to have a special clearance from a pediatric cardiologist before they could go do sports, which I think was, kind of an overkill.
Right,
Definitely
right.
an overkill.
The COVID, looking back, there were a lot of overkill things like that, I think, before
there
we
were.
understood. Yeah.
They were, but it was
Understandably.
Also, yeah, we were like gaining knowledge.
Right.
We didn't have knowledge
Right.
at that time. And so right now, the newest recommendations, now most kids have probably had COVID 3 or 4 times by now.
Wow.
But it's no problem except if the kid had such a severe COVID episode that they were hospitalized.
Okay.
Okay. And that particular child who was hospitalized should be written out for 3 to 6 months after their hospitalization. Okay. And the return to sports needs to be cleared by peds cardio.
Wow. Okay.
So
okay.
you might say, well, where's peds cardio here? Nowhere. And the closest peds cardio we have is occasionally there's an outreach clinic in Eureka at St. Joe's.
Oh, and it's not there all the time? There's just a clinic
No,
there
it's-
occasionally?
It's a dedicated group of doctors who have been coming up for decades.
Oh, wow.
From UCSF.
Oh, man.
So
Well, thankfully they've been doing that, but
Yeah.
still unfortunate that they have to do that to meet that need.
yeah, they're amazing physicians, and most kids with heart problems have already plugged into that
Right.
resource.
So if your child was hospitalized farther than 6 months back, is it not a concern then anymore? Or do you still need to
It depends
to be cleared?
what I read in that extensive history that people don't want to fill out. So, and then I have to question: did you read this? It kind of just depends on the situation. I think most kids would probably be passed if they had a normal exam and no further symptoms of concern.
Okay.
So here's what you do not do at a sports physical. You do not forget to fill out the forms.
This is like the
You
fourth
do not
time you've
forget
brought
to
this up.
bring them because it makes me crazy.
Right.
And we have blank copies if you lose them or if whoever was stapling the packet together didn't add them.
Now, I'm assuming that if you don't have forms, you get forms then and there, or the exam doesn't happen, right? Or is it
Right.
just, okay.
Right. And then the other thing is oftentimes things might come up on the physical that aren't really relevant to performance in sports. And, maybe they're discussed and written on the exam portion, but not really the business of the coach or the team or random nice volunteer mom who's getting the paperwork together. There's 3 forms. One is the history, one is the written out exam that has things like the objective data. So what we found on exam, what the blood pressure was, stuff like that. But the third form is just really definitive. Is this kid cleared or not cleared? And are they partially cleared? And if they're partially cleared, what's the concern and how do we mitigate it? And really that third form is what the coaches need.
Yeah.
And I think that should be the only one that's turned in. And that's what they do at Humboldt, but up here the whole packet goes
Everything
back.
gets turned into the coach?
Yeah, what if
Does
you're...
the coach get your medical history then?
Yes.
How is that not a HIPAA violation?
Because nobody's thought of it yet. So
You can't even get there's so many things that as a journalist and
Right.
with Redwood Voice, the things we can't find out just because of HIPAA concerns, whether or not they seem to apply at all. But
Right.
then they're just handing out these kids information to coaches.
right. So what I occasionally mention to people if there's sensitive stuff on there is, you know what? Here's the only paper your coach needs. Come
Okay,
back if there's
okay.
an issue.
right.
And then the other stuff is scanned into the chart.
Okay.
So,
Wow.
Yeah.
That seems ridiculous.
I know.
All right. So I've got questions. So Bronny James, right? LeBron James's son,
Okay.
had a heart attack last year while he was working up to playing for USC. How much of a concern is something like that for somebody who, as a kid, as a child athlete? I mean, how often does something like that happen?
Virtually never, but
Yeah.
these guys are not playing at that level either.
Right. Yeah, that's true.
You know, my daughter just laid down on the field and watched clouds when she did soccer. So, you know,
Not exactly Bronny J. Sure.
yeah. Although the college athletes have a requirement that a physician, only a physician, so not a nurse practitioner,
Oh,
not
okay.
a PA,
Okay.
has to do the form. And
Just
that's-
because the training is so much more. And
no, it's
like
because that's what's required by the insurance company. And I think that is because the training
Gotcha,
is much more.
gotcha.
I don't
Okay.
think the administrators in the college program, you know, that you can't find a doctor to do it in Humboldt County. So I've signed plenty of those off, and nobody's ever bounced them back to me.
Okay.
So, yeah. So I think that's the quality of the program, you know, conditioning program that he was doing, or the training he was doing. So, and there's actually some of the teams here that have trainers. I think it's probably, you know, volunteers, and they'll tape up like weak ankles and stuff like that.
Yeah.
So, you know, that kind of stuff is available here on the kids level too.
I can't imagine just undertaking any sort of thing like that. The liability has just got to be ridiculous to have, you know, like one of these leagues in town that have, you know, about 500 kids in them every weekend out running around
Right.
and doing things in that wonderfully uneven, holy field, playing soccer in Beachfront Park,
Oh, totally.
waiting for a twisted ankle. I'm
Right.
like, oh no, I
Right.
can't imagine.
Right.
Wow.
But there are parents who see value in that.
Oh, yeah.
And I don't know if they have release and hold harmless stuff or what, that the kids sign legal forms that hold them,
Yeah.
you know, forgive their good Samaritan efforts.
Yeah, right.
Yeah. So the cool thing about this was the whole reason I did this show.
Okay.
Del Norte Community Health Center's pediatrician, Dr. Hannah Parker, has
Wonderful
been on our show
person.
before.
Yes.
Is doing sports physicals on Saturdays. It's the second and fourth Saturday
Okay.
of the month.
Okay.
And it's the time the acute care clinic is open. So it looked like between about 10 and 2. It is not walk-in. You have to make an appointment. But here's the thing we'll be most happy about. Do not have to be a patient of the clinic.
Oh, that's great. That's
So
fantastic.
this is a way for parents to get the paperwork done with a wee bit of forethought.
Who made this possible?
I think it was Annabelle Dominguez, who is the center manager there, and I think it was. Well, I don't know if we can claim credit, but I think the issue of access to care for people, whether they're patients or not, is a huge thing.
And in Del Norte, yeah, especially.
Yeah, we've certainly spoke to aspects of it, and I think that they want to be more available.
That's wonderful.
Then the other cool thing is if the kid needs immunizations, and you have their shot records, although the medical assistants that work with Dr. Parker can go online in a hot second
Yeah.
and get immunization information, that they will update immunizations if that kid needs them.
Wow.
I know, they want to make it patient friendly.
Yeah, like a one-stop sort of thing here for you.
Super helpful. And I think she sees 6 patients in the 4 hours. They definitely bill them as well child checks, so they're a little more involved than the average sports physical, like vision and hearing and stuff. And she's a pediatrician,
That's wonderful.
which is specialty care we don't have enough of up here. So super awesome. You could give them a call, get an appointment.
And again, second and fourth
The
Saturdays?
second and fourth Saturdays, about 10 a.m. to 2 p.m.
Okay.
And I would call a little bit ahead of time because they seem like they're popular and they're filling up.
All right, yeah.
So she's going to do this to the end of August.
Okay.
Because that's usually when the need kind of peters out.
Okay.
So get your paperwork together and show up because it's an amazing thing.
That's fantastic. That's a great thing to hear. It's
and
such
thanks to Open
responsiveness.
Door for making the stretch to make it happen.
Right on. Well, that's it for this episode of Health Matters. Thanks again. I did not think we could fill a half an hour with this when we started talking. And you surprise me every time because there's so much to know.
Yeah.
Any thoughts for next week?
I don't know, but I'm thinking of maybe getting Dr. Raymer back. He wants to talk about cardiovascular disease, but he's so busy being retired.
Thank you, Lynn.